The World Health Organization recognizes COPD as the third most prevalent cause of death worldwide, where in 2019 COPD was responsible for more than 3.2 million of global fatalities. This is Abdulaziz Alyami. I'm a respiratory therapist and the educational lead for specialized therapy and clinical services. COPD, or chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that severely limits the airflow from to the lungs over an extended period of time. COPD encompasses various conditions including emphysema, which characterizes by destruction of alveolar sac that is responsible for gas exchange. And also we have chronic bronchitis, which characterizes by chronic productive cough. The main symptoms of COPD including shortness of breath with exertion, chest tightening, coughing and wheezing, and the patient has the tendency to develop respiratory infection. If the respiratory symptoms of COPD are not well controlled, the symptoms might get worse over the time. The primary risk factor for COPD is smoking, including all types of smoking, cigarette and electronic cigarettes. The other risk factor for COPD if the patient prolonged exposed to air pollutant, including chemical dust and other particles in the air. And also one of the most common questions we have faced in our clinics, if COPD could be a genetic disease, the answer is yes. If the baby was born with alpha-1 antitrypsin, he might develop emphysema, and emphysema is one type of COPD as well. COPD can be diagnosed by pulmonary function tests, including spirometry that measures lung flow, lung volumes, and diffusion capacity, along with other tests including physical examination, CT scan, chest X-ray, and arterial blood gas analysis. COPD is not a curable disease. However, it can be managed and controlled by providing the patient bronchodilators, including long-acting and short-actings. Also, we can give the patient inhaled corticosteroid to control the symptoms. And if the test showed that the patient has respiratory infection, antibiotic can be used. Pulmonary rehabilitation, smoking cessation, long-term oxygen therapy can be used at the same time to improve patient quality of life and to enhance patient coping with his disease.